Hello, this is Danny Blyth from the College of Integrated Chinese Medicine, looking at floating deep pulses in a little more detail. So this is third year pulse qualities for KICM students. Remember, this is for Chinese medicine students only. Please pause and read this. So in simple terms, a floating pulse is one that you can feel near the surface. A deep pulse is one that you feel further in. You have to reach down before you get to it. It's worth pointing out that if you have a patient who has very deep pulses, if they do get an external invasion, the pulse will become relatively more floating. It's not going to float all the way to the surface, but it will be more superficial than it usually is. So a floating pulse that's also deficient we refer to as floating empty. And confusingly, a classical pulse description of empty is one that feels like a balloon partly filled with water, or one that's floating and large but deficient below. And this is often seen in qi, or qi deficiency of the lung or the spleen, described in the classics as being gapingly empty below. The flooding pulse is normally floating. Its main characteristic is that it arrives with a lot more force than it leaves with. So it arrives in a great wave and leaves quite deficiently. So it can feel like it's rising up to hit the finger. It tells us that there's heat, often at the qi level, and often injuring the yin and the fluids. It can also be empty fire. A soggy pulse feels floating, thin and weak, sometimes a little bit slippery. Like a bubble of water that bursts when you press it, or like soggy cotton wool. It can be used interchangeably with a soft pulse. Jing, yin or blood deficiency, or dampness with deficiency, usually of the spleen but also can be with the lung. A leather pulse feels hard and wiry at the top and deficient underneath. So it hits the fingers and is floating, but you push below it and it's empty. And this shows that there's severe deficiency of Jing, Yin or blood, and it's usually seen in the elderly. A hollow or a scallion stalk pulse is just what it sounds like. It feels normal at the top, normal at the bottom, but in the middle, nothing. And if you move your finger from side to side, you can feel the edges of it. This is found either after a blood or body fluid loss, if the person's dehydrated, or sometimes it can precipitate a blood loss. The hollow pulse is usually, but not always, floating. The scattered pulse is floating and it feels fragmented into dots, like it's broken into small bits. So its shape, rather than a choppy pulse which can feel kind of jagged around the edge, it feels more broken up into small pieces. And this tells us there's a severe deficiency of qi, blood, or especially yuan qi. And it's bad prognosis if you get this pulse in pregnancy or before labour. So that's some different types of floating pulse. So a hidden pulse is just an extremely deep pulse. It feels like it's stuck to the bone. If it's empty, it's a more severe yang deficiency. If there's some fullness, it means that there's a pathogenic factor that's stuck deep inside. This is usually cold, but it can also be phlegm, blood or qi. A weak or a frail pulse is simply one that's not only deep but also thin and weak. And either there's a qi deficiency and the qi's not raising the pulse, or a yang deficiency. And finally, a confined or a firm pulse, sometimes called a prison pulse, is one that's deep or somewhat deep, but also wiry and strong. And this is a sign of qi stagnation interiorly, interior cold, or an imbalance in the chongmai. It's said to be tied to the bone. So if we have a thin and deficient pulse, if it's also floating, we call it soggy or soft. If it's also deep, we call it weak. A pulse that's wiry and hard, but also floating and nothing underneath, we call leather or drum skin. If it's also deep, we call it confined or firm. So a deep pulse that's extremely deep, we call hidden. One that's also deficient and thin, we call weak. And one that's also wiry and hard, we call confined or firm. A floating pulse that's also thin and deficient, we call soggy or soft. One that's wiry, wide, taut and hard, but empty below, we call leather or drum skin. And one that feels scattered, irregular and broken into small dots, we call scattered. So that's another look at floating and deep pulses.